For me, when I talk to patients about materials, it's a really simple conversation. It's about what would I have in my own mouth, what would I put in my family's mouth.
I own a restaurant and I also sell real estate, so my smile's really important.
I work in customer service and in an office, so I greet people who come in and out, answer phones.
I was a wedding DJ before dental school, and now I'm getting ready to graduate and move on to my career as a dentist.
I'm a general dentist of 21 years, and my practice itself is a restoratively based practice. e.max is definitely cutting edge, although it's tried and true, and that's probably one of my favorite qualities about it.
I did have a filling years ago, and the discoloration in both the teeth, one different from another. I was having a hard time with it because in pictures I could see the difference.
A couple of my teeth were just a little crooked, and then I had the spacing and the bonding was breaking down, so I knew I wanted to do something with them.
So when I was 8 years old, I knocked out my front tooth in a bike accident and had a Maryland bridge for about 13 years.
You know, I look at strength and I look at aesthetics. So whenever I'm evaluating a patient to determine what material I'm going to use, I need to know how pretty does it need to be and how strong is it. So I know, I have confidence that that material is going to exceed their expectations. You can't beat over a decade's worth of history and know that as a product, it does exactly what it says it does, and it's time tested.
I love my new smile, and I'm very confident now in my pictures, my real estate pictures, my advertising, my marketing. It feels really good to be with my clients, not feel like I want to put my hand over my mouth. I'm very confident with it.
I had friends and family members stopping me in conversation and just saying, "Wow, your teeth look great." And I just said, "Thank you."
My wedding was actually the first day my family and friends really got to see my new smile. It was kind of a sense of pride that I had that new smile that day.
I'm going to say the longest standing e.max restoration I have is probably on my dad, and I'm going to say 12 years. And he has a mouthful of e.max where we restored anywhere from single tooth implants to crowns to veneers. He has a bridge, he's got it all. There's not a better reaction that I see than when we restore someone with e.max in the anterior segment. You know, we get everything from patients crying to hugs, and cards come in the mail, and they bring their spouses back. They're as excited as we are when we look for the very first time and see the result. It's totally transformed how we practice every day.
When it really matters, make it e.max.